Hello everyone, I am Dr. Dharma Kumar KG, Consultant Surgical Oncologist at BGS Gleneagles Hospital, Kengeri, Bangalore. So today I want to discuss about what is surgical oncologist role in a cancer patients and why the surgical oncologist should be a part of surgical treatment of the cancer patient. ಸೊ ನೀವು ನೋಡಿದ್ರೆ ಕ್ಯಾನ್ಸರ್ ಪೇಷಂಟ್ಸ್ಗಳಿಗೆ ಎಲ್ಲ ಥರದ ಟ್ರೀಟ್ಮೆಂಟ್ ಇಂಪಾರ್ಟೆಂಟು. ಅಂದರೆ ಇಟ್ಸ್ ನಾಟ್ ಓನ್ಲಿ ಅಬೌಟ್ ರಿಮೂವಲ್ ಆಫ್ ಎನಿ ಆರ್ಗನ್. ಒಂದು ಪಾರ್ಟ್ ತಕ್ಕ ತಕ್ಷಣ ದ ಸರ್ಜರಿ ಕ್ಯಾನ್ಸರ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಆಗೋದಿಲ್ಲ. ಸೊ ಇಟ್ ರಿಕ್ವೈರ್ಸ್ ದ ಆಂಕೊಲಾಜಿಕಲ್ ಪ್ರಿನ್ಸಿಪಲ್ ಆಫ್ ಅ ಕ್ಯಾನ್ಸರ್ ಪೇಷಂಟ್ ಆಫ್ ದ ಟ್ಯೂಮರ್ ಸೊ ದಟ್ ಯು ಕ್ಯಾನ್ ಟ್ರೀಟ್ ಆ್ಯಂಡ್ ರಿಮೂವ್ ದ ಕ್ಯಾನ್ಸರ್ ಅಫೆಕ್ಟೆಡ್ ಪಾರ್ಟ್ with the oncological principles. That is why it is very important for a cancer patient to undergo surgery by a surgical oncologist, especially who are trained with the cancer principles and cancer treatment. And also along with that, as a surgical oncologist, we have a tumor board discussion for all the patients who undergo cancer treatment with the medical oncologist and the radiation oncologist, so that we can frame a proper treatment protocol for a particular cancer patient. As a surgical oncologist, we operate all part of the body, most of the part of the body we can say, except brain ಮತ್ತೆ ಬೋನ್ ಸ್ಪೈನ್ ಟ್ಯೂಮರ್ಸ್ ಬಿಟ್ಬಿಟ್ಟು ಹೆಡ್ ಅಂಡ್ ನೆಕ್ ಕ್ಯಾನ್ಸರ್ ಆಗಿರ್ಬೋದು. ಹೆಡ್ ಅಂಡ್ ನೆಕ್ ಕ್ಯಾನ್ಸರ್ ಅಲ್ಲಿ ಬಾಯಿ ಕ್ಯಾನ್ಸರು, ನಾಲ್ಗೆ ಕ್ಯಾನ್ಸರು, ಆಮೇಲೆ ಇದು ಮ್ಯಾಂಡಿಬಲ್ ಅಂತ ಹೇಳ್ತೀವಿ. ಮ್ಯಾಂಡಿಬಲ್ ಕ್ಯಾನ್ಸರ್ ಸರ್ಜರಿನ ಮಾಡಿಬಿಟ್ಟು ನಾವು ತೆಗ್ದ್ಬಿಟ್ಟು ಅದು ರೀಕನ್ಸ್ಟ್ರಕ್ಷನ್ ಮಾಡಿಸ್ತೀವಿ with the plastic surgery help jote. Then we also do thyroid surgeries and the parotid surgeries, and so because thyroid surgery is one of the most common cancer, and also the oral cavity malignancies like mouth cancers are the most common cancers we see in India, and it is the main treatment is the surgery only, and it is ideally done by the surgical oncologist. Adadmele what we deal is breast cancer patient, where the surgery is one of the mainstay of the treatment, and again it is done by the surgical oncologist, where we do a breast conservation surgery. We don't remove the complete breast, we just remove the involved part of the breast and the breast lump, and then we do a complete removal. We call it as a modified radical mastectomy and the radical mastectomy, wherein we remove the entire breast, and for some selected patient we do a plastic reconstruction of the entire breast with the plastic surgeons, with the implant, and also with the autologous soft tissue transplant. And in breast conservation patients, we do a oncoplastic reconstruction for a defect. And we also put a chemoport insertion wherein we give a chemotherapy for cancer affected patient. With the help of the chemoport, we don't have to use the IV lines. ಅಂದರೆ IV ಲೈನ್ ಇಲ್ದೇನೆ ನಾವು ಇಲ್ಲಿ ಕಿಮೋಪೋರ್ಟ್ ಹಾಕ್ಬಿಟ್ರೆ ದಟ್ ಇಸ್ ಪರ್ಮನೆಂಟ್ ಆಲ್ಮೋಸ್ಟ್ 2-3 years ತನಕ ವಿತೌಟ್ ಎನಿ ಪ್ರಾಬ್ಲಮ್ ನಾವು ಕಿಮೋಪೋರ್ಟ್ನ ಯೂಸ್ ಮಾಡ್ಬೋದು. ಅದಾದ್ಮೇಲೆ ಥೊರಾಕ್ಸ್ ಅಂತ ಬಂದರೆ ಥೊರಾಕ್ಸ್ ಅಲ್ಲಿ ಮೋಸ್ಟ್ ಕಾಮನ್ ಈಸೋಫೇಗಸ್ ಮತ್ತೆ ಲಂಗ್ ಕ್ಯಾನ್ಸರ್ಸು, ಅಗೇನ್ ಚೆಸ್ಟ್ ವಾಲ್ ಟ್ಯೂಮರ್ಸ್ನು ನಾವು ಸರ್ಜರಿ ಮಾಡ್ತೀವಿ. ಸೊ ಲೋಬೆಕ್ಟಮೀಸ್ ಆಗಿರ್ಬೋದು, ನಿಮೋನೆಕ್ಟಮೀಸ್ ಆಗಿರ್ಬೋದು, ಈಸೋಫೆಗೆಕ್ಟಮಿ ಅಂಡ್ ಚೆಸ್ಟ್ ವಾಲ್ ರಿಸೆಕ್ಷನ್ಸ್ ಅಂಡ್ ರೀಕನ್ಸ್ಟ್ರಕ್ಷನ್. ಸೊ ದೀಸ್ ಆರ್ ದ ಕಾಮನ್ ಸರ್ಜರೀಸ್ ವಿಚ್ ಇಸ್ ಪರ್ಫಾರ್ಮ್ ಬೈ ಅ ಸರ್ಜಿಕಲ್ ಆಂಕೊಲಜಿಸ್ಟ್. ಅಂಡ್ ವೆನ್ ಇಟ್ ಕಮ್ಸ್ ಟು ದ GI ಸರ್ಜರೀಸ್, ವಿ ಡೂ ಆಪರೇಟ್ ಸ್ಟಮಕ್ ಕ್ಯಾನ್ಸರ್ ಅಂದರೆ ಜಠರದ ಕ್ಯಾನ್ಸರು, ಮತ್ತೆ ಕೊಲೋರೆಕ್ಟಲ್ ಕ್ಯಾನ್ಸರ್, ಕರ್ಲಿನ್ ಕ್ಯಾನ್ಸರು. ಅಗೇನ್ we do a pancreatic surgery like Whipple surgery, and then apart from that we do a gallbladder surgeries like radical cholecystectomy. So these are the common surgeries we do, and we do it with the oncological principles, which is very important for all cancer patients. And apart from the GI cancer surgeries, we do a gynec oncological surgeries like uterine cancer surgery, cervical cancer surgery, and the ovarian cancer surgery. So now with the advent of surgical technology, we do a cytoreductive surgery and the IPEX surgery for the ovarian cancer and the peritoneal cancer patients, wherein we remove all the involved part of the abdominal structure, so that the chance of cure will be high. And along with that, we do encounter the urological malignancies like kidney cancer and bladder cancer, wherein we remove the part of the kidney and the entire kidney also. So along with that, we also handle soft tissue sarcomas, wherein the muscles and the bone is affected with the cancer, wherein we can preserve the bone also. And then we do a mega process with the help of orthopedic oncosurgeons, and Yeah. So these are the commonly done surgeries by a surgical oncologist. So it is very important to undergo surgery with the surgical oncologist, because the oncological just it's not only about the removal of the cancer affected organ, and it is very important to remove the affected organ with the oncological principle and the cancer principle, so that the chances of recurrence andre ವಾಪಸ್ ಬರೋ chances is very minimal and the chance of cure will be high. Thank you so much.